Okay, so we've done step 1 and step 2. So step 1, body balance, right below the belly button, 2 inches or 2 fingers. Step 2, reset the nerve. Bring that nerve to a higher state, because you can't have immunology without neurology. Most important thing that I've ever learned, and the laser is better for resetting the neurology than any therapeutic modality I've ever used. I've used it for over 20 years and it's just phenomenal. So in an acute injury, so for the first 3 days, we would use a protocol on the whole area. You'd like to be on skin, but for demonstration, we're going to show you by painting the area. So we're not going to be on skin this time, but we're going to paint it. And so what we're going to do is we're going to start in the infrared. And we're going to do this for about 1.5 minutes. So as you can see here, I'm not going to be looking at it much. Hopefully the camera can pick up on it. This is when I get to apply it in an area. So we have the hip, we have the area here, and we're going to do this for about 90 seconds. If you only had a laser that had red, then you would do it for about 3 to 4 minutes. I like about 3 to 4 minutes per area is a good time, unless it's something really specific. Now, once I paint the area, I'm getting a combination of some great healing aspect going here. The beautiful thing about the laser, it's like a tool that does 100 different things. It helps with the inflammation. It helps with the pain. So when you had the pain, how would you rate the pain when you snapped that thing? It was probably
off the chart.
Off the chart, right? So we had a little bit of the gout with, so it was not a combination with the gout, but off the chart. So the leg was dislocated. It was really traumatic. So we had to wait about 2 or 3 days because it was around Christmas time before we can even get the surgery. So the poor Sam's laying there with really the leg not even being operated on, a big piece of the femur hanging out there, and we'll try to show you some x-rays when we do it. So about 90 seconds of infrared, and then we're going to switch to the red beam, okay? So now we have a brighter light here that you can see. And again, I'm painting the area. So what are we doing while we're doing this? What's happening is that the laser is stimulating the cells, and especially the mitochondrial DNA. The DNA is what produces the ATP, mitochondrial DNA increased ATP. What does ATP do? It helps to stimulate the peripheral nerve. It helps the muscles to relax and unwind. And at the same time, it brings it up. So not only is the laser great for pain, great for inflammation, and we can see that his leg was almost twice the size of this leg when we first had it, and you'll see that on some other videos, but it's going to decrease the inflammation, help the cell to pump it out. So the energy that the cell is also for detoxifying and pumping out that inflammation and to getting things out of the cell and out of the interstitium. And that's going to get to a protocol we talked about, which is going to be the lymphatic, which is going to be later on, okay? So anything that's acute, we're going to use these settings. It's going to be about 3 to 4 minutes, starting with infrared and then going to red. All right, so that's our protocol for number 3, acute pain.